you through that.
Okay, so I'll just say that what motivated me to start this, I've thought about it for quite a few years, is the person you see on the screen is my mom in her 20s. And when she died at 88, she was completely bedridden, had to be in a special reclining chair because her bones were so fragile. And the weekend she died was the weekend I met Vajra Mishra. And I said to Vajra, I said, I might not be able to stay because I was on a course he was teaching, and my mother's in hospital. I might have to leave suddenly. And he took me aside. He taught me a mantra. He gave me some holy basil cream to put on her forehead. And he said, this will make her passing more gentle. And so how can I not be forever grateful for that? So I would just like to start with a mantra that Vajra taught many of us who were his students, that he said that when we speak from the heart, we can never make a mistake. And this mantra is to connect us to that energy. I'll try and speak up. Maybe I'm being a little bit too quiet. So it's Hri Pundarik Madhyastaham Paratah Surya Samaprabham Pashankushtaram Somyam Varadabhayahastakam Trinetram Raktavasanam Bhakta Kamadudham Bhaje. And so that mantra is saying that the Divine Mother is always, always looking after us. She's protecting us. She's the balance like the morning sun. And she removes fear. And that's important about what I'm going to talk about. She removes fear and also guides our desires in the right direction. So I'm hoping that everything I say today will be guided by that. So starting, as I already said, this is really an epidemic in the US. And as I was looking through some of the material, became very clear why so many people are having problems with bone health. And a lot of it has to do with a lot of these trends that come forward. Before, people didn't want to eat foods high in cholesterol. Well, you'll find that cholesterol is very, very important in our diet, the good cholesterol and everything it does. So I thought I would just use the ebook, and rather than me talking, I would take some questions. How many, let me see, how can I do this? How would I know? There's about 40 people on the call. And I have no way of knowing how many of you have actually read the ebook. So I am going to put the ebook up on the screen. Let's see, where can I find it? Sorry, I thought I had it up already. Here it is. Okay. So basically, I chose 7 things that people could do to make sure that their bones are strong. And the very first thing I put on there is ghee. And some people that were emailing me were concerned that possibly if they're being treated by Dr. Teitelbaum, could they do some of these things? And almost everything I am saying here either came directly from Vajra, who was Dr. Teitelbaum's mentor, or from Marianne's books and recordings. And I've been a client of hers. And I've also taken many people and done 3-way calls with Marianne I give them some of the basics that I know Marianne would like. And then, we have a call and Marianne will tweak those things for people. So there's nothing here that would be contraindicated in Shakavansya Ayurveda. Ghee is fundamental in the book.
Yeah. Can you reshare your screen there, Elizabeth? Because all we see is your beautiful face. There we go. Okay.
And I click
And
on
if
this.
you're watching and you don't see the ebook, you can also pin Elizabeth to make everything else smaller and see your
Can
ebook
you see
better.
that now? Can you see that?
Yes.
Okay, so here. So Ayurveda talks, I found this very fascinating. One of the first things Vajra taught us, I must say, he was very big on energy medicine and spirituality and all of those things, but also very practical. And many of us had been studying Ayurveda for many years, but always felt it was so vast and so complex that how do we actually incorporate it into our daily life? So he said, don't worry, I'll give you some simple things to do. And one of the simple things was hydration, which is one of the things in the book. Maybe I'll click down to hydration first. Oops, there. So hydration, and I have a story with that, and I'll say also why I'm bringing it up first. In Ayurveda, there is a cascade of transformation of tissues. And we don't see this in modern medicine. We don't hear it. We talk about biochemistry and enzymes and all kinds of different things, but I've yet to see anyone catch up to this wisdom of Ayurveda. That when we eat food, everything goes first through the liver. And in modern science, it's called first pass. And first pass is considered not always a great thing if you're taking drugs, because often the drugs are destroyed. And so therefore, drugs are injected or put it on as a patch or applied to the skin somehow. And in Ayurveda, everything we eat goes through the liver and is transformed into our intelligent blood. Vajra used to say, all the dumb food and things you take has to be made into intelligent blood. So the first thing that is created from our food is the plasma. From plasma, it goes to red blood cells, from red blood cells to muscle. So some of it stays as plasma, red blood, and muscle, and then part of it is transformed to the deeper tissue, more deeper. So then from muscle, we go to fat. Now, this is the part that's really interesting. From fat, we make bone. So we have to have good hydration to get through all these things. And also we incorporate fat through our diet, but it has to be a specific kind of fat. So if we don't get through these 4 transformations, then we never really get good quality fat to make good quality bone. Now, from bone, we go to bone marrow and deeper tissues, but we're only concerned about bone. So I'll just tell you a quick little story. I didn't even introduce myself. I should tell you, I worked as a pharmacist who, about 4 years into my career, I was working in a hospital and I was handing over a big bag of medications to the man. And I realized in that moment, I had this kind of aha moment that his mind was making him sick. And so I kind of went off and started studying psychology and meditation. And through meditation, I found Ayurveda. And so I'm at work one day, and this woman comes in, hands me a prescription, and she says, can you print out the side effects? And hardly anybody ever does that. So I thought, wow, this woman's quite on the ball. So I printed them out, and she said to me, "Why would I take this? Side effects are worse than my disease." And so I had just met Vijay, and he had given us this recipe for hydration. And it's coriander, fennel. At the time, it was marshmallow root. He then changed it to Indian sarsaparilla and then mint. So I said, "Oh, would you be willing to try a little herbal tea if you're not going to take the prescription?" And you have to know, I was working at Zeller's pharmacy. Nobody was around that could hear me. I might have lost my job if I had done that. So she said, "Sure." And I said, "So what are your symptoms?" I knew it was an anti-inflammatory for her colon. She said, "I have 12 bowel movements a day." And the doctors had done, all kinds of tests on me, and they say it's either irritable bowel, Crohn's, can't remember all the things she said. But, she took and I thought, well, she'll probably never do it. She came back 2 weeks later, all her symptoms were gone. And I thought, Baiju was right. He would give us simple things to do that would make a big difference. So I would think that, when I said 7 daily habits, you might not do this every day, but it's not that hard to do. Take a container, put the 4 herbs in there the night before, fill it up with water in the morning, turn it on, make a tea, and drink it over the next 4 hours. You would be amazed of all the things that this helps. Coriander supports the kidney, fennel supports and cools the liver and supports digestion. If you can't get Indian sarsaparilla, like it says here, which you can use marshmallow root, which lubricates channels, and mint helps things penetrate. So this simple hydration drink is quite amazing. So that's one thing. So maybe I should stop. What I'll do is, because the purpose of this is to answer questions. So let's stop after each thing, and people can put their little hand up. Do people know how to do that? Carol, can you explain that?
Sorry, my mouse went crazy there. Yeah, so as part of this, you can go into React and raise hand like Jennifer just did. So Jennifer, if you want to unmute yourself, you can ask your question.
Hi, I'm curious about why he changed the marshmallow root to Indian sarsaparilla.
Indian sarsaparilla is specific for detoxing fat tissue. And so we want healthy tissue without toxins in it to build the bone.
Okay. Is it also a binder?
It's not a binder as far as I know. I don't think so.
No, it's
Okay.
not.
Then,
the one that marshmallow root is also helpful for lubricating the lining of the stomach
Uh-huh.
and helping with like leaky gut. So one or the other have their own benefits, but and both are helpful.
And then, if you're getting a private consultation with Dr. Teitelbaum, she will tweak that water. Sometimes she'll put another herb in, or some neem, or what's the other one? That's a good lubricator. So yeah.
Thank you.
Okay. Julie.
Hi, I was wondering, can you give this tea to children as well? Or is there an age that you would kind of cut off? Because I have a 5-year-old all the way to a 16-year-old, and I'm thinking, oh, I could make this for everyone, except maybe there's sort of a threshold where it would be more beneficial.
I think the coriander fennel, I mean, I know people make fennel tea for colicky children, and coriander is a cooling herb. I don't know about Indian sarsaparilla. That's the only one I don't know. That I would have to ask somebody a bit more, has more. Teitelbaum definitely has experience with children, so you could ask her if you had.
Yeah, she would know, or maybe switch the marshmallow root in until I find out.
Yeah, and mint, of course, everybody. So none of them are particularly. They're not herbs that only a serious practitioner could recommend.
Okay.
Santha.
Thank you. See, Thanks for the nice presentation. Actually, I joined a little bit late. So what are the ingredients in the tea?
Do you have the ebook?
No.
Oh, okay. Maybe you could put your email address in the chat, and I will send you the ebook. But it's coriander, fennel, Indian sarsaparilla, and mint.
Okay.
There's
And
a special way to do it. It has to be in spring water,
Okay.
water that is has prana in it, water that has not been chlorinated. What you're basically doing is you're taking the intelligence of the herb and putting it into the vibration of the water.
okay.
If any of you are familiar with the work of Emoto, he was the Japanese scientist who did lots of work on water and how water picks up vibration. And so that's what happens when you're making a herbal tea.
So you said like coriander, fennel, mint. What's the other ingredient?
Marshmallow root or
Okay.
Indian sarsaparilla.
Okay. Thank you. Have a nice day.
So, Carol, can you, if some people write their email in the chat, could you write it down and email it to me? Because I don't know, I don't want to have to think about that as well.
I'm sorry, I'm not able to find my raised hand, so I just waited. Can I quickly
Here you
ask?
I can,
Yeah.
okay.
I know one of the things it says is when I read about that tea is, does it make a difference if I make it and take it at one go, as opposed to taking it over a period of 4 hours or 3 hours? Simply because it's easier if I make it, cool it, and drink half a glass of it, as opposed to distributing it. I may be in or out of the house.
You're making a liter. You're making a liter. So yeah, you drink what you can. I mean,
Okay.
you drink
Got
what you can. I mean, a lot of times I'll just forget, and then
Mhm.
oh my God, there it's still sitting there, you know?
Exactly.
I understand what you're saying, but we do the best we can.
Okay. Thank you. So it's not recommended to take it in one go. I mean, that's the main thing.
I just know it'll just flush through you more quickly,
Ah.
right? You'll
Got
be, you know, it'll just flush through you more quickly.
You don't benefit.
This way you're kind of hydrating, you know, your body
Mhm.
over time. I would think that would make more. Okay.
Thank you.
All right. So now that we've got, let's see. Yeah. So I might as well go to magnesium because it's on the screen now. And several years ago, I read a book by Dr. Carol, can't remember her name, but basically she had worked for 20 years doing research on magnesium and found that every pharmaceutical depleted magnesium from the body. And if you've listened to any of Dr. Teitelbaum's videos on magnesium or calcium, you'll know the very, very big importance of magnesium. Magnesium helps the bone formation as well. I think it's about 50% of the mineralization in the bone, but also it is important for something from 500 to 700 enzymatic transformations. Everything from activating ATP in the mitochondria to, sorry, somebody just walked into the room, to being on the outside of the cell and making sure that the calcium magnesium balance is, it's just amazing everything that magnesium does. One thing that most people don't realize that if you take it orally, it can irritate the lining of the colon. When I used to work, before I knew how much it irritated the colon lining, I used to recommend it for people that had constipation because it would give them more bowel movements. Magnesium's important for muscle, for the heart, so many things. So it balances, you can read here, it strengthens bones, but balances sugar, elevates your mood. It also makes you feel more relaxed because it's relaxing the muscles. So if you look at my fingers here and you see this as a muscle fiber, what calcium does this, it contracts things. What magnesium does is the actin and myosin in the muscle fiber, it makes them relax. So I didn't put this in the ebook, but stress and tension is also important. Reducing stress and tension is important for a healthy bone. We know that stress makes cortisol go up, and it also, cortisol has an effect on bone formation. So magnesium has many, many benefits. And oh yeah, I have Dr. Carolyn Dean at the bottom there. If you ever get a chance, you can find her on YouTube and find her book about all the benefits of magnesium. However, the brilliance that Vaidya brought to Ayurveda is that he realized that because of this great load of toxins and the way people are eating on our liver, as I said before, everything you eat must go through the portal vein, first through the liver. And there's a group of enzymes called the P450 enzymes that have to transform that into intelligent blood. In the ancient times, the ancient doctors knew that somehow this was important, and they talked about the 5 burners, and they said, the liver has 5 burners, and it transforms fire, air, water, earth, and ether. 5 elements. Sorry, I must admit I'm a bit excited about doing this, and I'm excited with so many people being here. So, so I cannot talk about more about than the benefits of magnesium, but also the importance of taking it through the skin. So Chandi has a magnesium roll-on, there's magnesium creams, there's Abhyanga oils you can use with magnesium. One of their biggest sellers is a Vata pacifying magnesium vitamin D oil. All of these things are a way of getting magnesium into the blood. Also, most people know Epsom salts. Epsom salts is magnesium sulfate, which must be converted to magnesium chloride. So the best magnesium to apply to the skin, soak in a bathtub with magnesium chloride. Now you can go to health food stores and find magnesium oils, which are basically about a 10% magnesium solution. So I think I will go back to ghee. We'll go back to ghee. Because as I said, this whole thing of transformation from plasma, blood, muscle, fat, and then bone marrow. So we have to have good fat to build bone and then bone marrow. And in the ebook, I talk about Dr. Weston Price, who realized in the 30s that the American population was getting quite sick. He saw all kinds of chronic illnesses. He was a dentist, and he saw the deterioration of the bone in people's jaws. And so he traveled the world and looked at what cultures were really healthy. And he found a common denominator in there, and he called it Activator X. And at first he thought it was vitamin D, but he then realized it was vitamin K2. And vitamin K2 is high in milk, butter, and ghee, and it's about 300 units in ghee. So if you want to know more about ghee, I have I can send you a kind of concise notes I made about ghee for this course from Dr. Teitelbaum's book. So. Any questions about ghee? I should say that with all the trends towards veganism and this is, I think, part of the serious problem. That's what's happening is people are not getting good quality saturated fat. It has to be saturated fat, not unsaturated. Okay. No questions? I'll go to pH. This is something that was really amazing because most of us, you know, who are afraid of getting osteoporosis will go and get a DEXA scan to see whether, you know, our bones are deteriorating. And one thing I discovered early on is that there's a way of testing to see if you're leaching your bones. And the way to do that is to test our saliva pH. And the reason being that if our saliva is acidic, that means our blood is constantly under pressure, and the blood cannot vary in pH. It has to be within a very, very, very narrow area. And so if our pH is getting more acidic, where's the biggest source of alkalinity? It's the calcium in the bone. So what happens? The blood will take the calcium from the bones if our pH is acidic. So this, you can test your saliva and know that, I'm close to 6.5, getting close to 7, that's okay. If my pH, salivary pH is 5, I better start looking why that is. So you can go online and find many, many alkaline diets. However, one of the biggest causes of acidity in our body is not so much even the food we eat, but the liver and gallbladder. The bile, and this is kind of a story, and I hope I can explain it. Okay, so here we are. We're eating all this wonderful food. We made it with ghee. We, you know, we bought it as fresh as we can, and we made it at home. We didn't just go to McDonald's and have a burger. We're doing the best we can. However, the liver, if the liver is hot and full of toxins and overloaded with the supplements, the drugs, the pollutants in the air, even the cosmetics that you're putting on your skin, all of that, the liver gets overloaded. And therefore, the bile is affected. So when we take food in, first goes into the stomach. The pH in the stomach is 2. It is highly, highly acidic. It kills a lot of the bacteria that are there with the food. It breaks down the protein. The stomach works really hard with all that acid. And then it's going to pass it on to the intestine. The intestine is alkaline. How does that highly acidic food then get turned into a more alkaline product that can move down the intestine? The alkalinity of the bile is 8, highly, highly alkaline. So if we don't have the liver producing good bile, our blood will become more acidic. We'll be leaching calcium from the bone. You don't hear that. I've never heard that on modern medicine. Only, and I think Baiju used to always say, modern medicine will catch up with Ayurveda. And I hope it does. I hope it does. I hope it does. So most of you know that the liver is a big organ on the right side of our body, just under our rib cage there. And it, as I said, must transform the 5 elements into good blood. And it's not only the burden of toxins, but food and all of that. So one of the things that, you have to look at is what are you taking besides food through your mouth? And that is often a difficult conversation to have with people because they're so concerned about getting the right vitamins and the right things into their diet. So we have to be very careful and that the supplements we take are necessary. And that's all I'll say about that. So I will take a breath and see if anybody has any questions about this. Okay, go ahead, Shanta. I can't hear you. Are you muted? Okay, Ruth.
Can you talk a little bit about calcium? A little bit more about calcium? I understand the magnesium and I understand the heat, but instead of the body taking the calcium out of the bones, is there any other way that the body can supplement calcium to the bones?
Yes, and that actually, I think is my very last thing here. I've got it on the screen. So this I found quite disturbing. I found this in the Journal of Internal Medicine 2016 that they were doing research on calcium supplements and do they actually reduce bone reabsorption. And what they found that they might in the short term, but they didn't find that that the negative effects of these supplements warranted the safety of taking that supplement. And I don't know if you can see here on the screen, 5 large studies failed to demonstrate fracture prevention, but they found that it increased gastrointestinal side effects, including doubling hospital admissions for those. 17% renal calculi were increased and 40% increase in risk for myocardial infarction. And each of what this study said, each of these adverse events alone neutralizes any possible benefits in fracture prevention. So in Ayurveda, the ancient doctors knew they didn't have the modern technology that we have, but they knew that certain molecules like iron, calcium, and zinc and others were too large or too difficult to be assimilated into the body. So what they did is they created what is called a basma. And what they did is they burned these minerals over and over and over till they became very, almost like nanoparticles that were easy for the body to assimilate. And so there are, if you are going to take calcium, I mean, calcium is not such a concern. If you, many foods are high in calcium. Broccoli, milk products, if you use milk products, they're all high in calcium. It's usually the balance between calcium and magnesium that is a concern. So
Is there, sorry.
Repeat your question then. Is your question is how am I going to get calcium into my diet? Is that what your question?
Yeah. I've been taking calcium and it seems like instead of really helping my bone, it's accumulating in my heart and I have to have a valve replacement now. So what I understand, the calcium is really not being absorbed by my bones. And you go to the doctor and they said, oh, take 1,500 milligrams a day of calcium and it will mess up my stomach. I wouldn't be able So my question is there like the magnesium, the way the magnesium is being absorbed through the skin, is there anything like that with the calcium?
This is what I was saying. There are these basmas where they burn the calcium molecule, and Chandika does carry them. Somacal, and there's another one that's a powder, and you take small amounts of that. Are you a vegetarian or?
No, I'm not vegetarian. I
Okay,
do.
you use milk product, or you?
That's where it's at. So I use milk product. My cholesterol is getting higher and higher, and so
Are you on cholesterol medication?
yes, I am.
Okay, so the first thing to look at if your cholesterol is high is your liver. Cooling your liver and making it more able to process the cholesterol. So we need cholesterol, but the cholesterol is converted into hormones. It's the precursor for testosterone, estrogen, and other DHEA, other hormones. So if the liver is overloaded, so look at, talk with your healthcare provider and see which of your supplements you really need to take. Look at those things that I talked about, you know, what things, your hydration. And there are specific herbs made as glycerides that will actually cool the liver and make it better to process. Are you familiar with Dr. Teitelbaum's work?
Yeah, I did. I've seen her for like 3 years and nothing really happened, so I quit.
Okay. So I'm surprised that you were still taking calcium if you've been talking to her. What kind of calcium were you taking?
The seaweed calcium.
What kind?
Seaweed calcium.
Oh, seaweed. Okay, sorry, I'm not familiar with that. I know that seaweed's high in iodine, but I didn't realize it was high in. Well, learn something every day. So, okay, Mary, go ahead. Ruth, have I answered everything or?
So what calcium are you recommending, really?
The ones that are called basma
And where do you get them?
from Chandi. It's the only one that I know.
Okay.
Okay, Mary.
Okay. I don't know how to sort out where I'm at before I get into more chemicals and things. I had a really bad reaction to infusion, and I think I sent you the name of the acid that I did.
Yeah, it's a bisphosphonate. Before you go on, I should just take a minute to talk about bisphosphonates. This is the class of drugs that are used by modern medicine to treat osteoporosis. Fosamax is the oral one, the most common one that you hear. There are Prolia, other injectable ones. What bisphosphonates do is they stop the breakdown of the bone, and hopefully the bone will keep building. What has been found, though, is that because a bone is a vital organ, a vital tissue, a live tissue, it has to be constantly breaking down and rebuilding, breaking down and rebuilding, so that if you stop the breaking down, the bone can become quite brittle and still break in the jaw and in the big bones and the legs and those kinds of things. So many people are not finding those drugs particularly helpful.
So how do I sorted out like the decrease, bone density decreased in the year 12 months following that by an additional 6%, which it had decreased. It was a 7 years and it had decreased 6%, and now in 1 year it's decreased 6%. And I really, I'm trying to sort out. So this was timely because my body just isn't reacting or acting the way I guess a lot of bodies do. And I don't know how to,
Well,
I just don't know how to sort it all out.
the way I look at it, there are these different, I call them different boxes. You know, you're in the
Yeah.
you're in the modern medical pharmaceutical box, you're in the homeopathic box, the naturopathic box, and we're right now in the Chakavansiya Ayurvedic box. So this box particularly, it's not, I think it's important to say that, you know, Ayurveda has its own system of medicine, herbs, diet, and lifestyle, you know, going to bed on time, eating high at noon, all those kind of rules they feel are best for keeping our bodies healthy. However, the ancient doctors also knew that every age there would be different challenges for people. And I think that's the brilliance that Dr. Mishra brought, is that he realized when he was using the Ayurveda that he was taught at college, it wasn't working in North America because our lifestyles, our diets, everything was different. And that's when he realized that our livers were very hot. We were not digesting our food properly. We were not assimilating our food. And he came up with different ways to deal with that. So in these 7 little things, I've just put together some of the fundamentals, because when you come to Ayurveda, a lot of people say, oh my God, how can I even do this? There's too much to understand, too much to do. So first, hydration. 2, get some good quality fat. Reduce your supplements if they're not essential. Start cooking your own meals. You know, be careful of the fats you use. All those canola oil, safflower, sunflower oil, all of those oils are really, really create a sludge in our bile. The bile cannot create alkalinity. So our food, so it just goes on and on. So that's what, let's do just those 7 simple things. So where can you start, Mary? You know, you say you got the drug, you had a bad reaction to it, and your bone is still not increasing.
No, it's, in fact, it decreased as much as it had in the 7 years previous.
So therefore, you have the experiment on your own body.
Yeah. And then I got this information from you that you were doing this, so here I am. Like,
and it's nice to see you. And
yeah.
We can talk again after.
Yeah.
Okay.
Okay. Thank you.
Bye-bye. Alicia.
Thank you. If taking sesame seeds, handful of sesame seeds a day would be enough for the right calcium support daily, or still a basmati are recommended on top of that?
I don't know I don't know. I know that sesame seeds are high in calcium. What I do is I roast them and I grind them and I put them in things. It's easier for me to digest because I always wonder if if my body would break through the sesame seed. I always wonder, or if it would just go through me. I know the Japanese make something called gomatsu, where they roast sesame seeds, they grind them up, and they mix a little salt in them, and they use it as a. You say a handful of sesame seeds?
Yeah, that's kind of the dose that is usually recommended for the daily dose of calcium.
Didn't know that. Well, it's good to know. So I think
But
calcium,
because otherwise, like for the postmenopausal women, though taking the basma, that means they have to be taken till the rest of their lives just to have that calcium support.
and also, I do remember asking Vajra, we're all quite vain, and I said, Vajra, how can I lose weight? And I was just menopausal when I met him. And he said, no, you don't lose weight. Don't lose weight. You need a little fat. Also, your adrenal glands produce estrogen. So reducing stress levels, supporting the adrenal function is good for balancing. So fat tissue, adrenal support. But yeah, good to, well, I knew sesame seeds are high in calcium. I didn't know the dose, but thank you for letting us know.
Thank you.
Okay.
Yeah, Elizabeth, as you move on to Marie, she also put in the comments here about sesame seeds being more of a heating. They do have that agni to them. And depending on your body type and the liver's heat, if it's overheated, can sesame seeds be something to avoid? I'm thinking that might be the question buried in there. Or how much is too much, possibly.
Mary Amram. Oh, it's a pleasure to meet you. I see you.
Nice
Hi,
to meet
Mary.
you too again.
I see you on the Facebook page, and it's you always have wonderful. I'm honored that you're in our group.
Yes, I just wanted to highlight one of the other products that Vaidya made, which I always recommend to my clients, because it can help people, even people who are reactive to everything, to enhance their calcium levels very quickly and safely. And you know the products, I'm sure, Elizabeth. And what I use is Somacal. It's one of the basmas that you mentioned, but it's one of the basmas that has the least reactive power, I would say, because it is just coral calcium from young coral. And so it is really helping balance the pH quickly. And you can, when you buy that product, it is presented in capsules. And so you can open the capsules and use as much as is best for you. You can start with a little bit of powder and mix to your food, lunch and dinner, and you can put a bit more depending on what your therapist will recommend. But this calcium is the easiest to absorb as far as I know. And it is really helping the digestion, the pH in the blood and the liver calm down and cool. Because the other day I was researching for a client about the Shilajit product that you mentioned. I thought also it would be a good product to boost the calcium levels and all the physiology, the energy and mineral metals. But as I was talking to Dr. T the other day, she mentioned that when the body is in a place of illness, weakness, and reactivity, let's say autoimmunity or IBS, irritable bowel, the Shilajit in the product, which is called Soma Shakti, the Shilajit is so powerful, full of metals, that it can burn and aggravate all the burning in the gut. So this would not be something that she would recommend to self-medicate with. You could say to use on your own. You would have to ask Elizabeth to assess your gut or assess if this is for you. And what she suggested, instead of the stimulation that the Shilajit brings, she suggested the memory nectar drops, which are called Soma for her, or Soma Shakti for her. Yeah, Shakti for her. And these drops do not have the Shilajit in them. So that there were two things that I work with. It's the Somacal, the young coral calcium, which is the simplest form of calcium, easily absorbable. And to stimulate the metabolism and strengthen the body using the Soma for her, the Shakti for her drops.
How about
Because
mineral, how about mineral support? Because I was under the impression that the Shilajit is mineral support is a nectar, is the glyceride drop for Shilajit is.
Yes, that would work as well. And because if you take the Shilajit in the Soma Shakti capsule, they are pills actually. The mineral is raw in there. It's too much mineral together, too much metal.
Okay.
So it's very powerful. And for those who need it, as Vaidya says, it's perfect, but not everybody needs it. And if the body is irritable or has autoimmunity or liver heat, it can burn really bad. And yeah, so the other two are better. The one you mentioned, multimineral, can be taken, but also the Somacal is the simplest and best absorbable calcium for everybody. And you can dose it. You open the capsule and you take small amounts instead of taking the whole capsule at once.
Thank you.
So you can, it will last you for a long time.
Thank you so much. That's wonderful to have you here and have your wisdom.
Well, thank you. This is a great seminar. I'm enjoying it. You present the information so clearly and it's well explained. Thank you.
Thank you. And it's so needed. It's so needed. And I forgot, thank you for bringing that up about sesame, because I never thought about it in sesame seeds, because I know sesame oil, when you're cooking with sesame oil, you have to be very careful because it's quite heating. I remember watching Melina, Dr. Tekborian cooking, and she added a lot of coriander, which is cooling, when she was doing something with sesame oil. So yeah, sesame seeds can be heating, so we have to be careful. All right, so whew, wow, what time is it?
We are 10 to the hour.
Yeah.
So I guess that's 3 o'clock your time.
Yeah,
6
we've
o'clock
been-
for us
we've
on the
been-
East Coast.
We've been sitting for a long time, so what I would like to do is take like a 10-15 minute break to move our bodies and come back, and then Alicia will be first. Is Alicia got? No.
No,
No.
we have Ruth still with her hand raised. Do you want to take that one and then take a break, since it might be on topic to what you
Maybe
just
she
finished?
didn't lower her hand. Ruth,
Oh,
did you have another question? I think she just didn't lower her hand.
okay, I did for her. And then, yeah, we could take
Yeah,
that break.
so I think we should, I just need to stretch my arms and walk around a little bit. Sitting in front of a computer for a long time makes my neck sore, so I have to get up and walk around. 2 hours is too long. So I'll see you in about 10-15 minutes.
You should be able to pause the recording for this too.
Okay, how do I do that?
Yeah, it should just be able under more record. You can just hit pause, not stop.
Wait, I gotta get back here. More. More. Oh, here. Pause. Pause. Yes, I did it. Okay, we'll see you in 10 minutes. Okay. Chloropesa. Did I pronounce your Chloropesa? I can't hear you.
Okay, sorry. Yeah, it's Oropesa, O-R-O.
O-R-O. Oh, okay.
Thank you for doing this. I had two questions just briefly. One of them is, what do you think about the SVA Liver Pro to do like a little, not daily, but maybe a couple times a week as a little bit of a liver kind of cleansing treatment?
What I was told to start with was liver clay.
Okay.
Pulls the toxins out of that one.
Are you familiar with this one?
I'm not actually, what is it? Spa Liver Pro.
Yeah. I got it from Shadika.
Yeah, and what can you read the ingredients?
Yeah, it's Mishra's Property Blend with grapefruit, yang yang, and sweet orange in a base of organic shea butter with vegetable glycerin, beeswax, and jojoba oil.
So the liver blend, and it was it recommended by a practitioner to you?
Yeah, from my Ayurvedic practitioner.
Okay. So she must have done some assessment that felt it was right for you. I'm sorry, I can't answer.
That's okay. No worries. I just thought I'd see what you thought. And
Mostly I've seen like after you do the liver clay, which you put it on for about 5 minutes. And then DGL is the cooling deglycerated licorice paste. That's what I've seen.
okay.
So I'm not sure how that would vary. Maybe somebody on the call, like Marie, might know. Do you know, Marie?
Yes, if it was recommended to you, it means, like Elizabeth said, it means that your therapist has assessed that your liver could safely be stimulated in the elimination of some toxins.
Mhm.
But you have to watch what is your reaction to it, because if your liver is still a little bit aggravated, it can stimulate too much into cleansing mode. So I don't know how you feel right now, if you feel your liver is comfortable or you have sometimes strain and pressure, you have to assess that.
Okay. Yeah.
If your liver is comfortable, you don't have pain there, you don't have indigestions, then you can use it, like you said, twice a week.
Mhm.
That is good, a small amount, and watch for your reaction.
Great. Thank you so much. And then just quickly, I was wondering if the magnesium, I felt like when I was in my early menopause stages with hot flashes, I found it heating. Do you think that that is true, or could it have just been I was using it at a really kind of hot time?
Would you like to answer, Elizabeth, or?
I've never heard of magnesium being heating.
Okay.
Yes, well, if I may.
Go ahead.
So it depends where you put it on your body.
I was putting it like on my adrenals, like at the back.
Okay, so that's not a good place to put it.
Okay.
So magnesium it's helpful for everything in your body, but it is very stimulating also. It's part of the metabolic stimulation. So it is best to put it on your lower legs and your lower arms, and then you massage it in by rubbing, like this and rubbing. You shouldn't put it over any organ.
Okay.
And especially the heart or the face. And you can put it on the back where you have muscle if you have pain or tension, but not on organs. I think that's what Baidia usually said, isn't it, Elizabeth?
Yeah.
Not over organs.
I was always told to put it on my calves, on my lower legs. I don't know if you heard Dr. Tattlebaum was talking about magnesium on one of her videos where her husband was put on some medication and his heart went into palpitations.
Yes.
They were almost ready to take him to the hospital, and she just put magnesium all over his back. And
Yes, on the back is fine because there's enough muscle to
Yeah.
buffer the concentration of magnesium. But you wouldn't put it on your heart
not
in the
on the
front.
hospital, but on the back.
Yeah, on the back. Yeah.
By the upper back, not lower.
Yeah. But
Not
don't
over,
put it on
not
the
over
back.
the kidneys or anything. I didn't know
Wow.
that you shouldn't put it right on an organ, but that
No.
makes a lot of sense because it feeds all the enzyme systems and ATP, everything. actually.
Yes, but the problem is the concentration. It's better if you put it on the lower arms and lower legs because then it gets diluted by the flow of the blood once it gets to the organs and it's the right dilution.
Thank you so much. It's very helpful. Thank you.
Great question. Thank you. Okay, so where are we? Yeah, so I was just kind of scanning my ebook, and it looks like all the basic things that I wanted to cover, I covered. So we could go to more questions, or yeah.
I would like to ask a question about remedies for anxiety and or depression. I am taking several of them from Chandiga, but I have no idea what I'm doing.
Are you under the care of a health practitioner or a doctor?
Not at this time, no.
Okay, so you're kind of trying to figure it out on your own.
Yeah, using Mukuna, Prana Balance, Calm Mind, Rose.
You have some kind of practice, like a meditation practice or something?
Yes, occasionally.
So I think the first thing I would say that regularity, even in the old books, the treatment for depression was getting up first thing in the morning and going for a walk.
Yeah, it's more the anxiety coupled with fear.
Okay. For me, we were talking about magnesium. Magnesium is very relaxing. Also,
Yes, I use that as well.
so it depends on, are there a lot of challenges in your life right now?
I am my biggest challenge.
Okay.
It's just generalized fear, anxiety, racing mind, just constant thinking. I don't believe I'm the only one, but of course.
Usually the mind is stimulated by something in our environment. And also, what came to mind is Tulsi, holy basil. I would maybe not do everything all at once. Just try Tulsi. Are you do you know about the Marma points?
Not enough. I was on Prozac for 40 years and got off of it in February, and do not want to be on pharmaceuticals. So
yeah, it takes a long
coming.
time to wean off for your body to start making those neurotransmitters on its own in a balanced way. So if you were on it for a long time, you're having to wait and be patient for the body. But holy basil, Tulsi, comes in a, I'll tell you a story. When we first met Vaja, we were learning the Marma points, the temples. There's points all over the body where the energy body is connected to the physical body. So we had a choice of which herbal cream we could put on our Marma points. And for some reason, I chose Tulsi. And I remember putting it on all the Marma points on my body. And I just lay there. It was like I was in bliss and totally relaxed. So I would love to hear if it would work for you. Putting it on your third eye, on this forehead, all over the forehead, even on your temples.
Is it a cream?
Yeah, it comes in a cream and a lotion. The lotion is more water soluble. It's not greasy, but it comes in a cream as well.
So
So comes
so your
in a little
recommendation is
roll-on bottle. Be very careful when you get those roll-on bottles. Sometimes the roll-up pops off, so just be very careful. But I would put it on your third eye and your temples, and do it like. I think what I'm getting from you is regular routine. Start just with
Excuse me, may I add something? What works really quickly? The breath work. Breath is that link between body and mind, and doing the yogic breathing, as for example, Ujjayi, deep, long, elongated, deep breaths, or alternate nostril breathing, or many techniques that advance for the yogis, but mind is like a kite, and breath is this string that you can use and to pull the mind and control the mind. So just a little what I have.
So I'm sorry.
Good suggestion. The
Getting
many
back to
here
the holy basil you said is to use the cream or the lotion?
Doesn't matter.
Doesn't matter.
Yeah, between the two, the cream and the lotion, I can share just from also studying with Vaidya too. The cream is quickly absorbed into the skin and has more of a shorter term immediate action, where the transdermal cream, so that was the liquid, the cream will last longer and absorb more slowly and penetrate deeper. So you have like more of a long release effect from the cream versus the liquid. So that's really, and again, yes, the cream is more of a greasier feel because it's got the shea butter and that as a base. And like the roll-ons, you can get them in mini travel sizes. So you can take them on the go and do it that way. And actually, I would even recommend maybe you and Elizabeth get together and talk more about the Marma points. There's this Marma meditation, the Samadhi Marma meditation that we've all practiced together many a times, that can be very helpful because a lot of times our emotions around anxiety, depression, getting in our own way is about a closed heart lotus. And this Marma meditation helps open that up and allows us to relieve those emotions, move past them, and in a sense, digest them as well too, so that this regularity and the lack of, drop down these anxieties and depressions can fade with it.
Yeah, and I should also say that if you have been on an antidepressant for a long time, that is an issue. How did you come off it? Did you just go off it a cold turkey, or did you slowly wean yourself off of it?
I slowly weaned myself off of it, and I was good for about 2 months or so, 2.5 months. So that would have been February through April, and then since May, I've been feeling it big time.
Feeling anxiety.
Yes. And thank you for everybody for being patient with this question, but I needed to ask it.
I think it's a bigger question than just Tulsi and breath, and it's a bigger question because coming off something like that you've been on it for decades is not something that we can just address quickly here.
So that's something that you could address with me, is that correct?
I could give it a shot, yeah.
Thank you. Thank you, everybody, for their patience.
Okay, we're here to help. Elizabeth, I was going to just ask real quick, did we restart recording?
No, you didn't. I didn't.
Okay.